6:57, and we hear the word stroke and think it only happens to the elderly. However, it can strike at any age, and when it strikes, every second counts. Neurosurgeon Dr. Paul Saphier from Overlook Medical Center is here to share information that could potentially save your life or your loved one's life. Nice to have you here.
Thank you.
So why do we associate strokes predominantly with the elderly?
Well, there certainly are a lot of different risk factors that are involved. They're what we call modifiable and not modifiable. Certain ones, such as age, you know, the older we become, the higher the risk of having a stroke. But certainly anyone at any age is subject to having a stroke.
Yeah, it's susceptible, and we've seen that at an earlier and earlier age, and we're talking about women are at higher risk now too. So how can we recognize a stroke, and what should we look out for?
That's the most important thing, is recognizing the signs and symptoms of a stroke,
okay,
whether it be in yourself or your loved one. You know, there's an acronym that we use, FAST, F-A-S-T.
Yep.
F stands for face, any sort of asymmetry in the face, facial drooping or whatnot. Arm, any sort of weakness, clumsiness in the arm or the leg, or funny sensations. And then speech, the inability to understand or be able to speak clearly. And then time is really recognizing it quickly and acting upon it.
Yeah, how much time do you think? Or every second counts in that?
Every second counts.
Every second counts. All right, there is new technology that's out there, so tell us about that. Telestroke?
Absolutely. So Telestroke, essentially, in a nutshell, is getting patients in front of a physician in as quick of a time possible.
Okay.
And it enables us, Telestroke essentially is like a robot camera mechanism by which the physician can remotely evaluate the patient in real time and do a physical exam over a virtual airway.
Yeah, basically we have this video here, which is sort of a reenactment. So tell us exactly what's happening. Is it just looking at all of those symptoms and making sure the EMTs know exactly what's happening at that time?
Absolutely. So in this particular video, the paramedic is assessing a patient and connecting the patient remotely via the robot Telestroke mechanism with the neurologist, who's evaluating the patient and conducting a physical exam and evaluating the patient, seeing what is actually happening.
That is pretty amazing. I mean, I just love how technology is just helping us live longer. Let's talk about new treatments as well. What else do we need to know about?
Absolutely. So, you know, in the acute time setting of an acute stroke, patients are sometimes able to receive what's called intravenous TPA, which is a clot-busting medication. It helps dissolve the blood clot that's blocking the blood vessel, and sometimes we can actually go into the blood vessels themselves and perform what's called a mechanical embolectomy, reaching in and pulling out that blood clot and restoring blood flow to the brain.
Pretty incredible, pretty incredible. Thank you so much for helping us, you know, talk about stroke, the new technology that's out there, and treating it. Hopefully you learned something out there so you could save someone's life, because every second does count.